Good evening, everyone, and a very warm welcome to today's session on decoding liver cancer, early warning signs, and modern treatment approaches. The session is organized by Voice of Healthcare in collaboration with Isai Pharmaceuticals. So, liver health is often overlooked until some serious problem arises. The liver quietly performs over 500 functions from detoxifying harmful substances to produce essential proteins and supporting metabolism. But unfortunately, conditions like hepatitis, fatty liver disease, and cirrhosis can progress silently, sometimes even they can lead to liver cancer. So, by understanding the early signs, risk factors, and treatment options, we can take some proactive steps to protect liver health and improve survival and quality of life. I am Dr. Muskan Ahlawat, and I will be leading today's discussion. I hope we will have a wonderful participation from all of you who care about understanding one of the most vital organs of our body, the liver. So it is my pleasure to welcome Dr. Priya Tiwari, Head of Medical Oncology at Artemis Hospital, Gurugram. Dr. Priya will help us understand the underlying causes, warning signs, and some latest advancements in liver cancer care. Hello, ma'am. A very warm welcome to you for joining here us today.
Thank you. I think it's a very nice initiative. Thanks for the invitation.
Sure, ma'am. Ma'am, to begin with, first we would like to understand very basic questions that what is liver cancer and what are some major causes or underlying conditions, that can increase a person's risk of developing liver cancer?
That's a very good question. See, cancers from the liver is liver cancer. Now, what is cancer? Cancer means that uncontrolled proliferation of cells. All our body organs are made up of cells. So these cells, they have certain functions to perform. They perform some functions and they eventually die. But what happens in cancers that because of some defects in the DNA of that cell, the cells refuse to die and they proliferate in uncontrolled manner. And that leads to cancer, lumps of cancer. So, cancers can form in any part of the body. If the cancers are forming in the liver, we call it liver cancer. They ultimately compromise the liver function, and that is why we don't want cancers inside the body. Liver cancer is now increasing in India. It's increasing because of the various risk factors. The commonest risk factor is alcohol. Yes, because of alcohol, liver can actually, a lot of problems can happen in liver. Hepatitis, alcohol induced fatty liver disease, but also liver cancer is also seen because of the alcohol. Besides alcohol, we are also seeing that the changing lifestyle. These days we are now sedentary and we are eating more calories, we are eating refined food items. All this is causing something called as fatty liver disease. Okay, non-alcoholic fatty liver disease. These fats accumulated inside the liver will eventually put a lot of stress on the liver cells, and they will cause deformities in the liver cells, and eventually they'll progress to liver cancer. Because of these problems, because of we are just having a Western lifestyle now. Okay, the kind of food items that we are eating, and now because we don't want to run, we don't want to exercise, we don't want to jog, because of the lack of physical activity, we are seeing a lot of obesity also. And because of obesity, because of these problems, a lot of liver cancer cases. There are certain infections, rare infections, which can cause liver cancers too. But those kind of problems are not very commonly seen in India. Now, hepatitis B and hepatitis C are two viral infections which can cause liver cancers. Hepatitis B vaccination is easily available, and that is why I recommend that hepatitis B vaccination should be done to everybody. You should get vaccinated. In our sector, in healthcare sector, it's mandatory that we get a hepatitis B vaccination, but I recommend for everybody, because if you prevent a hepatitis B infection by vaccination, you can actually prevent hepatitis B related cancers too. Hepatitis C, thankfully, is now the incidence is decreasing, but this is again a virus which can cause damage to your liver cells, which ultimately can convert into liver cancer. So these are some common risk factors for liver cancer.
Thank you so much, ma'am, for this clear explanation about liver cancer and the causes of liver cancer. Ma'am, as you were mentioning about alcohol and lifestyle, My next question is related to that. That many people, assume that liver disease only happens after years of alcohol use. And so, ma'am, in your experience, how would you say that lifestyle habits like obesity, diabetes, hypertension, or poor diet contribute to liver cancer risk?
So it's a very important question. See, people think that cancer is something very different. We just don't know anything about cancer. We have heard about diabetes, heart attack, stroke, hypertension, and we think that cancer is something different. What you have to understand that cancer is essentially a lifestyle disease, and all the risk factors, whether it is diabetes, hypertension, obesity, all these and cancers, all these problems are quite interlinked. All the risk factors are quite overlapping. If you have a sedentary lifestyle, if you are obese, you have a higher chance of diabetes, you have a higher chance of having a heart attack, and you also have a higher chance of having cancers, not just liver cancer. Any kind of cancer risk will actually increase. So you have to understand that cancer is essentially a lifestyle disease in majority of patients. The kind of lifestyle, the kind of food that we take, okay, the kind of exercise will decide ultimately how that cell health is going to be. With the kind of food that we now eat, the kind of stressors that we now face, the lack of sleep, the irregular lifestyle, all these are stressors for your cells. Okay, and they eventually these cells will give rise to altered body metabolism. And because we are eating so much of food and we are exercising less, there's just lot of there's just lot of calorie intake that ultimately converts to fat. These fats are deposited inside and the outside of the cells, and they ultimately compromise the cell function. And all these problems, the altered metabolism, the fat deposition, because of our lifestyles and the way we are treating ourselves, ultimately leads to cancer formation.
Thank you so much, ma'am, for highlighting, eye-opening lifestyle factors that are significantly increasing the risk. And I'm sure that if we make small daily choices, we can truly save our liver. So, ma'am, moving onwards, as we learned about basis of liver cancer, coming to its diagnosis part, as diagnosis is the main aim of identifying any disease. So, how crucial is early diagnosis in liver cancer management, and what are the screening methods nowadays that clearly detect it early, or how can we learn about some screening methods that we should know?
See, the important thing is one has to understand when you have a healthy liver, the chance of cancer goes down. The risk factors that we talked about will cause some problems in liver slowly, so that the cells will actually start to degenerate, and it will actually convert into something called as chronic liver disease or cirrhosis. Cirrhosis means the cells have degenerated to an extent that the liver functions will start to get compromised. Now, if you have a bad cells, degenerated cells, we know that that acts as a ground, a fertile ground for any cancers. So, liver cancers usually happens with the background of chronic liver disease or cirrhosis. So, we know that the patients, people who have chronic liver disease or CLD or cirrhosis, have a higher risk for liver cancer. And that is why we always recommend that such patients should go periodic checkups to pick up these cancers. That is the most sure short way of detecting cancers in early stage. And why do we want to detect a cancer in early stage? Because we know that if you detect a cancer in early stage, you can actually cure the patient completely. The problem with the detection is that most of the time patients are actually not aware of having a chronic liver disease also, isn't it? Most of the time when the cancer starts to happen, then only some symptoms will happen and they'll go to the doctors. So it's very important that you should always get a periodic checkup done for yourself. Now, when you have a chronic liver disease, the usual point of contact is a gastroenterologist or a general physician, isn't it? So that person will actually look at the liver. It will tell that he or she will tell you that the liver health is not good and the patients are having chronic liver disease. So once the chronic liver disease diagnosis is made, that person is subjected to periodic screening using an ultrasound and a blood test. When the cancers are happening in the body, they secrete certain chemicals or what we call as the tumor markers in the blood, which we can detect. There is a marker called as alpha fetoprotein. Another one is PIFCA. So these two markers can be detected in blood periodically, and monitoring their levels, we can actually detect cancer's occurrence in a patient with CAD. So most important thing is anybody who has risk factors or after a certain age, all of us should actually go some kind of periodic checkups so that we can find out if there is chronic liver disease happening or not. And if somebody has chronic liver disease, a periodic checkup should be done to detect the cancers early. Now, when we talk about the symptoms, one should always know about the symptoms, isn't it? So, symptoms could be because of two things. One, because of the chronic liver disease, and one, because of the cancer, isn't it? Chronic liver disease means your liver is not functioning well. The liver functions. Liver is an organ that helps in the digestion. So that means that these people will have constant indigestion. The hunger will go down. There will be easy satiety. There will be some heaviness or sensation in their right abdominal parts. Also, weight loss could be seen. Also, if the liver functions are deteriorating, then jaundice can happen. Fluid formation in the abdomen can happen. Okay, and sometimes there could be changes like fatigue can also happen. Day night patients will a person will sleep in the day and wake up in the night. So those kinds of sleep cycle alteration can also happen. Rarely, and many times it's very common that when you have a bad liver, the pressure inside the blood vessels also increase. So these patients, they have a tendency that sometimes they can vomit out blood. So those are the common symptoms of a weak liver. And if the patient has a liver cancer, then we know there could be pain, lot of pain in the right abdominal region where the liver is actually present. And there could be jaundice, there could be bleeding from one or more sides of the body, there could be loss of weight, there could be loss of appetite, and the cancer can spread into different parts. Like if it goes in the lungs, there will be coughing, and if it goes in the bones, there could be a lot of bone pains and symptoms like that.
Okay. So, Dr. Priya, as you were mentioning about screening, I have a small doubt that when a person should go under screening, like young people should also go under screening, or there is a specific age that after this you should go under screening for liver cancer?
So screening, liver cancer screening is not recommended for everybody. It is not an age-based recommendation. People who have a diagnosis of chronic liver disease only, or in the people who have diagnosis of cirrhosis,
Hmm.
okay, only in those patients screening for liver cancer, because the cirrhosis patient, chronic liver disease patient, they have a higher risk, very high risk of having liver cancer. So only in that group of patient, this liver screening, cancer screening is actually recommended. So it's not for me or you. It is not because somebody has crossed an age of 30 years, 40 years, or 50 years. It's not like that. Only if you have a diagnosis of chronic liver disease, only those patients should be subjected to the screening for liver cancer. But yes, in those people, it should always be done and not missed.
Thank you so much, ma'am, for answering that very insightfully. So moving onward, so to the treatment part, my next question is related that what are some most of common promising new treatment options that are available today? One of the treatment that is widely acceptable is liver transplant. And how can these new age treatment help patient to improve the outcomes of the disease?
See, it's a very good question, and the good thing is that the we are getting a lot of new treatments for liver cancer. See, the unfortunate part is about the liver cancer is that you have an underlying liver which is not functioning well. Okay, so you need to treat that too. Now, for chronic liver disease, you don't have any specific treatment, and that is why when once if you have a cancer with the background of chronic liver disease, people actually recommend transplant. Now the problem with the transplant is most of the time patient come late, so that even the transplant is not an option. And second problem with the transplant is donors who don't have livers to donate, isn't it? So these are the
Hmm.
problem with liver transplant. But we know that if the cancer is diagnosed in time, and we suppose if it's a very small, then we know that you can just do a simple surgery, isn't it? And you can remove that. So surgery is always an option. Second option is, of course, transplants, liver transplant. The third option is, and which is now we are seeing the newer therapies coming. And what are those? Suppose if you have a liver, chronic liver disease, and you have more than like multiple nodules of liver cancer, you can directly do a liver-directed therapies. Okay, so you can put some medicines or some radiation balls inside the liver itself, along the blood circulation of the liver, so that the multiple nodules of cancers are addressed simultaneously. This is called as TACE, transarterial chemoembolization, or TARE, where the radiation balls are used, transarterial radioembolization. that helps to improve and control cancer for really long time. Sometimes if you have a very small nodule, just single or like one or two nodules, then you can also burn them. So there are techniques called as radio frequency ablation, microwave ablations, by which you can small nodules of cancers can be actually addressed. If suppose it's just extensive disease, if the cancer has gone outside the liver, okay, or if the other modalities are not possible, not feasible, then there are certain treatments available in form of tablets or injection. The tablets are usually targeted therapies. So targeted therapies are one of the latest advancements in the cancer care, where you can directly target the cancer cells. You find a target and directly target the cancer cells by certain tablets. Okay, they identify a particular target on the cancer cells. Okay, so like lenvatinib, sorafenib, cabozantinib, all these tongue twisters, all of these are target therapies in the tablets. They go and attack and control the cancer cells wherever the cancer cells be in the body. Okay, the other treatments are immunotherapies. So, liver cancer is one such cancer which does not respond to chemotherapy. So, immunotherapy. Now, immunotherapy is again a very new treatment in cancer. What it does is that it stimulates body's own specific kind of immunity to go and kill the cancer cells. So, immunotherapies are very effective in liver cancers. And whenever the patient comes, we see the whole profile. We see if the patient is suitable for liver transplant or surgery, or maybe some kind of, like I discussed, liver directed therapies. Otherwise, we offer them this combination of target therapies or immunotherapies. Because of these treatments, patients are now able to live long, maintain their quality of life, and that's helping many number of patients. Yes.
Thank you, Dr. Priya, for highlighting these innovative treatment options that are available widely today. So, ma'am, talking about patient well-being, for patient diagnosed at an advanced stage, what steps can help improve quality of life and the well-being during the treatment that they are undergoing?
See, a patient who has an advanced stage disease, the cancer is not just the treatment is not done by just one doctor. It has to be a team approach. It has to be a multi-pronged approach, because there are various needs that you need to address. Like the most common is, and the most important is, you're not just treating cancer and you're not just treating a patient, you're treating the whole family, isn't it? And you're not just treating one disease. We know that the patient might have underlying chronic liver disease also, isn't it? So you need to
Yeah.
have a gastroenterologist who can monitor the needs and the requirements of the treatment and optimization for the liver part. Okay, that is most important thing. The oncologist will decide that what could be the best possible approach for the treatment, such as whether you want to give them immunotherapies or the target therapies. Sometimes, if you feel that patient has lot of pain in the bones, then you can also do radiation. Radiation therapy for the control of the pain. So, the radiation oncologist or pain management. We have now clinics such as pain management clinics, those who can do some kind of nerve blocks. So, pain
Hmm.
management becomes the symptomatic management part becomes very important. Then you should also have somebody who is a counselor. Whenever a patient starts to have a cancer, there's just a lot of questions going on that maybe something I did wrong. There's just a lot of negativity, a lot of questions going on. The family is thinking whether we are taking right decisions, whether whatever we are doing. So there's a sense of guilt, anger. So you need a counselor also on the board to address all these needs. Then sometimes the patient would want to understand that what are the food requirements, what should I cook, what should I eat, and how should I ensure that the nutrition of the person is maintained. So nutritionist should also be there. So, and as I said, that sometimes if the surgery is required, then the surgeons help. So it's always a multi-pronged approach. These days, what we do is that whenever a patient is diagnosed with a cancer, a case is discussed always in the humor board, because you have specialists from all the major fields, like from the interventional radiologist, from the surgeon, from the radiation, from the medical oncology, because we know that what are the advancements happening in our field, and then we take a common decision to decide what is best for the patient.
Thank you so much, ma'am, for highlighting how teamwork would help in giving the treatment to the patient. So, as we are progressing towards end of the discussion for today, ma'am, let's have a quick myth versus fact segment where we will address some common misconceptions that are faced around liver health. So, ma'am, first would be that once liver cancer is diagnosed, many of us or the many of people think that treatment options are very limited or ineffective. So, as I was mentioning, that one of the most common treatment that general audience or the patients would know is liver transplant is the only solution. But you mentioned some of the more treatments. So, can you explain some more things about this?
So it's a very common myth that if you have a liver cancer, it's a death sentence. It's not like that. We know that patients who have cancers, whether they have an early stage cancer or whether they have advanced stage cancer, there's just a lot of treatment options available now, from surgery, radiation, transplant to immunotherapies and target therapies and liver directed therapies. A lot of treatment can be offered to the patient. So ensure that yes, you have had a discussion with a patient, with a person who is dealing with the liver cancers. A high volume center is always preferable, where you can actually decide, where the doctors can sit down and decide what is best for your patient, and that way your patient can actually live long.
Thank you so much, ma'am, for explaining this much of treatment that are available nowadays. So next myth versus segment question would be that, ma'am, nowadays people are having like multiple or various kinds of herbal detox drinks, some supplements that are available. So, ma'am, is it true that they are, they cleanse or cure any liver disease naturally, or it is just a myth that we take supplements?
See, if you have a healthy lifestyle, then that is the most important factor to provide to protect your liver. Okay, cut down on alcohol, cut down on smoking, maintain your body weight. Obesity is a big problem with the liver. Keep yourself active. Okay, include more and more fiber in your diet. That itself will offer hope to your liver and decrease your risk of chronic liver disease. Beyond that, most of the herbal supplements which are available in the market, we don't have data to suggest. See, there's no scientific evidence. A thing might be good, okay, for your health, but we just don't have scientific evidence to prove or to show that yes, that helps to prevent cancers. And that is why we usually don't recommend. But yes, we know that an active, healthy lifestyle, an antioxidant rich lifestyle, a fiber diet rich lifestyle, that actually improves health of your body and the body metabolism. So that I strongly recommend. But no specific food item, no specific herbal preparations, and nutraceuticals companies are launching a lot of medicines telling you that they are going to cut down on the incidence of liver cancer. It does not happen like that. So that way, I don't recommend a one particular food supplement, because we just don't have data to support that.
Thank you so much, ma'am, for clarifying these myths. So, one last question that I would ask for our audience is, now we have festive season coming, Diwali, we had Navratra and Dashera. So many of us indulge in, festivities, eating a lot, drinking. So, any practical tip that would you would like to give us? How can we get safe
So,
during these festivals?
that's very important, So, you fast. I'm a big fan of intermittent fasting.
Okay.
See, we are eating just a lot of food these days, okay?
Hmm.
And we are not exercising. So, we are not burning what we are eating actually. So, we don't need, the body does not need that much of food that we are eating. So, uh, fasting is actually very good for your health, okay? Um, so, in Navratri, you fast, on Diwali, you eat sweets.
Yeah.
Navratri might be more healthy than sorry, Diwali.
Diwali.
Okay, so important thing is, if you're not able to do a Navratra kind of fast, at least sometimes you should do an intermittent fasting. Even if you like, if you take a dinner before 8 p.m. and you do a next day breakfast after 10 a.m., that means you give your body at least 14 hours of rest to detox itself. I think that is very good for him. That is the most important thing that you should mind. Now, in festivals, of course, you should be very mindful. It's like that, okay, festivals are time to splurge. It's not like that. Okay, you should be always mindful. Be very respectable towards your body and be very responsible. Okay, this body is something that I think we should all treat as a temple, isn't it? So,
Yeah.
in the festivals, celebrate temples, celebrate festivals. Okay, bow down to temple. Your body is temple. So I mean that, see, you just start having sweets, the calorie intake goes up, you become very irregular in your lifestyle. People consume a lot of alcohol on festivals, isn't it?
Hmm.
So
Yeah.
I would say and suggest and recommend that refrain from those activities. Okay, festivals are the moments to keep yourself happy, isn't it? And we don't want to create moments where in long term, they create disasters for us. So keep the sweets in moderation, avoid alcohol at all costs, and be merry.
Thank you so much, ma'am, for joining us today and giving your knowledgeable insights on liver cancer awareness month. Thank you so much, ma'am.
Thank you. Thanks for the invitation. Happy Diwali.
Happy Diwali.